Welcome to Talk South Asian to Me, Season 2. My name is Mashal.
And my name is Anusha. Tune in every Thursday at 5 p.m. Central and hear us react to each other's stories about mental health and growing up in different South Asian households.
And remember, this podcast is not therapy. Engage with what feels entertaining and resonates with you, and leave what doesn't. Ooh, ready for our last episode of Season 2?
Yes, let's do a topic reveal. We're on Z.
Yes, we're already on Z. It's crazy. This is our last episode. How do you feel?
I feel like this just went by so fast.
Yeah. I feel like we were just getting started and figuring out who our guests are going to be in this season.
Yeah.
And now we are literally in our last episode.
I know. It's crazy. We didn't even get to all of our guests. We're wrapping up right before holiday season. Couldn't have planned it better.
Right. So our topic for today is zoning in on emotions, right? Mm-hmm. Understanding emotional regulation and how to really zone in on our feelings and help us support our mental health through that. Okay, so you ready?
I'm ready.
As you know, I was very drawn to this topic. I was just this is the one. I don't know why. It's my love for Inside Out, my love for emotions. I think this is very relatable to what I do at my work every day. So I'm really excited to talk about this.
Let's get into it then. Okay. Hear your thoughts.
Yes. So I wanted to kind of first just talk about emotions, kind of break that down for us. So as human beings, we feel a lot of emotions. That is normal. And there's no such thing as good or bad emotions. Mm-hmm. They just exist and sometimes exist without our control. And that's normal. Mm-hmm. Our society tries to label emotions as good or bad, but that is not really true. Mm-hmm. So I wanted to kind of give that disclaimer. Yes, it's so good.
Just okay, keep going.
Okay, so to define emotion, I use the American Psychological Association. So according to that organization, the definition of emotion is a complex reaction pattern involving experiential, behavioral, and physiological elements by which an individual attempts to deal with a personally significant matter or event. The specific quality of the emotion, right, for example, fear, shame, is determined by the specific significance of the event. So the emotion can be, in other words, or English, I guess, because I just literally just said the exact definition. The emotion can be, it can be induced by event, right? And then it not only is an internal feeling, but it can externally affect us too, our behaviors, our thoughts. There's also physiological elements, right? There's physical aspect to emotions too, which is, I think, so important. I feel like whenever, especially for me, when I first thought of emotion, I thought it was just in our brain or internal, but there's so many different parts to an emotion, right? Behaviors, physiological. So that's really important to point out. And then when I was looking into and researching zones, I found a socio-emotional curriculum that's out there. It's called, I don't know if you heard of it. It's called Zones of Regulation. Have you heard of that?
That does sound familiar, but I can't recall what it was about, honestly.
Yeah. There's a lot. It's a whole curriculum. There's a lot, but I just extracted. I just wanted to quickly, briefly review the zones of emotions that this curriculum talks about. It's from zonesofregulation.com. So this kind of curriculum ideology is that there are 4 zones of emotions, and they're by color. So blue, green, yellow, and red. So the first one I said is blue. These emotions are sad, bored, and tired. And these emotions are categorized by low energy, low intensity. So it's kind of by energy and intensity, the 4 categories. So sad, bored, tired is in the blue zone, low energy.
Is that where they come up with that phrase? Or I don't know is it a phrase or is it a saying? But they say oh, I'm feeling blue.
Maybe. Oh, that's a good point. Yeah, I don't know. It didn't say that in there, but that could be. That's a good thought.
Maybe.
Yeah, maybe. I'm not sure. We're gonna have to look into it more. I didn't want to I really wanted to do a dive deep into it, but I was I can't. That's gonna take too much time. So, but zonesofregulation.com. This is where this is from. So green is more of also low energy, but alert. So maybe a little bit more intense emotions. So for example, focused, content, calm. Like those are like the green zone. And then yellow is high energy, like being stressed, worried, excited. And then the red zone is like extreme intensity and high energy, which is anger, fear, and panic.
Mm-hmm.
And then when I like this curriculum goes into detail, like what each zone means and like what a person should do to regulate their emotions in that zone, right? But I really wanted to point out that the yellow and red zones, which has like the high energy, high intensity, like regulation is important. Like it's needed. So that was a little bit overview of emotions. Any questions on emotions?
No, that was fascinating. I feel like I learned
Okay.
something new.
Good. I'm glad. I was like, oh, I don't know if she's going to know all this already or all of you just to review. But I'm glad you learned something new. Okay, so now we're going to get into emotional regulation. Okay, so this is also from the American Psychological Association, and I'm just going to read their definition. So, emotional regulation or emotion regulation, those terms are used interchangeably, is the ability of an individual to modulate an emotion or set of emotions. So, there's two types of emotion regulation. There's explicit and implicit. So explicit emotion regulation requires conscious monitoring using techniques such as learning to construe situations differently or think of situations differently in order to manage them better, changing the target of an emotion in a way likely to produce a more positive outcome, and recognizing how different behaviors can be used in the service of a given emotional state. So explicit like is like the conscious way of regulating your emotions, like you're doing something active to regulate. Implicit emotion regulation operates without, deliberate monitoring. It modulates the intensity or duration of an emotional response without the need for awareness. And this could be like just like our body's physiological response to like an emotion. Like it does it kind of internally to reach equilibrium.
Interesting. Kind of like when
Mm-hmm.
you overheat, you sweat. Something like that.
Right,
Yeah.
right.
Nice.
Okay. So I found a lot of articles about emotional regulation, but the one from Simply Psychology really resonated, and I thought it like hit on a lot of important points I wanted to make today. So they have their little own definitions. I wanted to kind of a little bit more simplified definition, not that technical. Simply Psychology's definition for emotional regulation is that it refers to the processes individuals use to manage and respond to their emotional experiences, right? Like simple. Your regulation is just managing and responding to your emotions. That's adaptive and appropriate, right? Those are the key words. Like emotional regulation is that you're managing and responding to these emotions in a healthy way, right? It encompasses strategies to amplify, maintain, or decrease one's emotional responses. And then research shows that when a person practices effective emotional regulation, this has been linked to a lot of positive outcomes, such as an improved well being, better interpersonal relationships, and enhanced resilience in the face of stress and adversity. This is like really important and really stuck out to me is that emotional regulation is a skill. It's learned. So something that people don't think about. It's not something that you can, like some people might be more natural at it just because of their temperament or how they were raised or what was modeled for them growing up. But it is still a skill. It can be learned, it can be practiced, it can be developed. It's not something like whatever your level of emotional regulation is, you're not stuck with that. Like you can improve the process if you want to.
Where
And
did
I'll
you
go into that.
where did you pick up that this was learned? Because I mean, I agree. I definitely believe that this is a skill, but I wonder like I wonder if we also have an innate ability, like just kind of an intuitive
Yeah.
ability to regulate. Because I've seen many clients talk about way in the past having this intuitive regulation skill, but they shut it down because of the environments they're in. And then they have to like
Yeah.
unlearn and relearn
Yeah.
regulation
Yeah.
skill. But I feel like in some way, shape, or form, there's some intuitiveness to
Yeah.
regulating.
That's where the implicit emotional regulation. I'm talking about explicit. It's from like simple psychology, right? Like the explicit emotional regulation is learned, right? Like you can use conscious strategies and techniques to regulate your emotions. And I'll go into it too, like some examples.
Interesting.
But yeah, like the authors of this article say that this is something that can be improved on. It can be a skill. Not that like you're not born with it. That's not what they're saying. Like it's
Right.
just a skill that can be improved on, like something that we
Yeah.
can work on. Yeah.
Mm.
Okay. Emotional regulation is a process that influences what emotions a person experiences when they do have these emotions and how they experience it and express them. So a disclaimer that simply psychology gives is that it's important to not confuse emotional regulation with eliminating or controlling emotions, right? There's a
Mm.
difference between the two.
Mhm.
Emotional regulation is not really like taking out that emotion or eliminating it, but really moderating the experience and figuring out like, okay, like kind of altering the intensity or duration of an emotion rather than changing it completely. So this is like the skill part that we were talking about, like learning skills to regulate our emotions means that instead of acting impulsively and doing something that may be regretted later, we are able to make thought out choices. So like maybe a learned way, right? Or a modeled way of emotional regulation is doing something impulsively. But, adaptive emotional regulation is learning different skills to make sure that it's thought out. So some of
Mhm.
these strategies include, and these are some things that we've already talked about in previous episodes, are meditation, mindfulness, therapy, talking through emotions with loved ones, kind of working on emotional intelligence skills, journaling. I like this one, kind of being aware of your emotions and realizing when you need a break, right? So maybe paying attention to physiological responses and be like,
Yeah.
okay, I need to take a minute. Sleep hygiene is a good one.
Mm.
Some unhealthy strategies, right, are self injurious behaviors, alcohol, substance abuse, emotional eating. This one was like, wow, a lot. I see it. I've done this before and I've seen a lot of other people do before, which is avoiding difficult situations,
Mm.
right? Excessive use of social media and then withdrawing from others. And then kind of, I wanted to flip over for a little bit and kind of talk about what dysregulation looks like. Like, what is emotional dysregulation? How does that
Mm.
work? So, the definition of that emotional dysregulation is the inability to use healthy strategies to diffuse or moderate emotions.
Mm.
So, I like this example that Simply Psychology gives. So, I'm going to kind of read this from quote. Imagine a scenario where one of your friends does not turn up for a prearranged lunch with you. Instead of considering the many reasonable explanations for why this happened, this event can trigger feelings of hurt or abandonment for someone with emotional dysregulation. They
Mm.
may feel intense anger or resentment, resulting in acting on these emotions, such as shouting at their friend, accusing them of being a bad friend, or withdrawing from the friendship. So, someone with dysregulated emotions may have reduced awareness and understanding of their emotions. They might have an inability to inhibit impulsive behaviors. They might have heightened negative emotions, have a high sensitivity to emotions in a social context.
So basically, not really knowing
Mm,
how to understand their emotions and then learning how to communicate them
yeah,
effectively. So
yeah,
instead of ooh, there's this phrase I like to use with clients. I say that it's important to learn how to speak for your emotions rather than
right.
from your emotions.
Yes,
Right? When you
yes,
speak from your emotions, you're reactive. Right? It's just boom.
yeah,
Something happens, boom, you
yeah,
react. Versus responding and you responding looks like taking a moment to think about, okay, what is this emotion trying to tell me? What is it that
mm-hmm.
I need to communicate? And then speaking
Yeah,
for them. It's kind
yeah,
of like I always say it's kind of like our emotions are like little kids. We
yeah,
have to guide them. We can't let them
yeah,
be angry and yell at their siblings. We have to set an
mm-hmm,
example and say,
mm-hmm,
"Oh, it sounds like you're frustrated. Okay, why don't you share why you're frustrated? Why don't you share your feelings rather than
mm-hmm.
figured it out. You run the show."
Yeah. No, I like that example. And your example or your explanation is very similar to one of the strategies I'm going to talk about in a second.
Ooh, I love it.
I know. Look at this foreshadowing. So, causes of emotional dysregulation, I'll just touch on it because this is another deep dive. Like, what causes emotional dysregulation? There's a lot, but some things are temperament, trauma, and attachment styles. Three main things can cause emotional dysregulation. Okay, so now we're going to talk about the skills to build adaptive emotional regulation or emotional regulation. So the first thing it's important a person to do is when they feel an emotion to name the emotion, right? Become aware of it. So
Mm,
recognize and understand the emotion. A way in which you can become more aware of what you're feeling is to pay attention to what you're experiencing physiologically in your body. For
mm,
instance, you may have an unsettled feeling in your stomach when feeling anxious, or you may feel a tightness in your chest if you are feeling sad. So, like,
mm,
really naming the emotions, recognizing how this emotion is showing up in your body, and understanding it. That's kind of like the first few steps. The next is to validate. That's like, this one's like a really tricky. Sometimes people feel shame when they
mm,
recognize or understand what emotion they're feeling. So it's important to validate it and understand that there's no such thing as good or bad, right? Emotions are emotions, they're there. And then identifying or resolving emotional triggers, so like figuring out where is this emotion coming from, what triggered it.
mm.
And then this last one is what you were talking about a little bit, your strategy is chair work. It's like a name for it,
Yeah.
right? So imagining a conversation between different parts of yourself. So if you're feeling multiple, like little kids, like you said, like if you're feeling multiple emotions, right? You separate your emotions from yourself and kind of look within, like look from the outside in, like a third party. So for example, you can
Mm,
externalize an internal critical voice by giving it a chair. Notice when this part attacks vulnerable emotions, making you feel flawed, dialogue with the critic. Make them sit in the chair and be like, hey, why are you being my critic? What's going on? Right? Like, and then telling that emotion, like, hey, you're causing me pain, right? I don't, you and kind of work to uncover the unmet needs or shame driving its harshness. Yeah.
I was like, yes, 1,000% yes. I use that all the time. And it's so
Mm-hmm.
effective too because you kind of hit on it. And I think you said during the like validate part of it, it's so important to practice this kind of thinking and like really
Mm-hmm.
separate from it because one, all of your like all of your emotions, I should say, since we're not talking about parts right now, we're talking about emotions. Oh well. All of your emotions, they genuinely and truly at the core of it are very like self-protective. They're there
Yeah.
to look out for you. It's
Right.
just their execution doesn't always work for you. They're not always
Yeah.
helpful in execution.
Yeah.
Positive intent, poor execution.
Right. Right.
Yeah.
Exactly. I 100% agree. And when I was reading, this is the first time I was learning about chair work or like this parts work, right?
Mm,
Like you mentioned. And immediately Inside Out came to my mind. They
yeah.
have, like they sit in the chair, they control our behaviors, like these little emotions.
Yeah, that
And
movie
like,
is based on this theoretical approach. It's called parts work.
mm, yeah, I remember reading about it in the credits. They were like, oh, based on like parts
Oh,
work.
really?
Yeah.
Oh, that's
We
awesome.
stayed for the whole credits because I just wanted to like see if because there was a post scene. There was a post
Did I
credit
miss
scene
it? What
in
happens?
the second movie. I can't tell you. It's going to spoil to our listeners if they haven't
Well,
seen
I
it
feel
yet.
like I would have seen it.
You
Okay,
have to
fine.
look it up now.
Sure.
But yeah, I stayed and I like saw a lot of like credit that was given, like the names of the therapists and
Uh-huh.
licensed counselors that were
Nice.
part of the work for this movie to make
That's
it
so cool.
authentic. I know. I was so
That's
impressed.
great.
I was like, this is so good. This is
That's
meant
great.
more like this is meant for kids, but also adults. I love it.
Yeah. I
So
think it's like,
smart.
I mean, that's like a lot of really great Disney movies, right? Like they take
Hmm.
these adult concepts and they like try to teach kids in these very easy to understand
Yeah.
ways. I love that. Feels so
Hmm.
good for even us adults. I mean, I know so
Yeah.
many of us. Every single client I've told to like go watch Inside Out, they've all come back and reported the same thing. I cried and I was like, yeah, same girl, same. Me too.
It's so important to like for anyone to watch that movie just
Yeah,
because
it
it
speaks to you.
teaches, yeah, it speaks to you, but it also increases your knowledge like
Yeah,
about the parts work and like for
yeah.
someone who hasn't gone through therapy or still has that inner reflection that they would
Mm.
like to do, like this is a good stepping stone, this
I
movie.
love part stuff. I will
Mhm.
literally like not shut up about it. So if there's something else you might want to
Yes.
move along, I could say so.
Yes. I feel like I can go on and on about this too. So that was kind of like my general background, general research. Do you have any things to add for that or any questions?
I have so much to add. I probably shouldn't. We would be here forever. I would really just say like the basic level. This is a fascinating topic, and it's like
Mm-hmm.
one of the most important transformational skills we can have as adults.
Mm-hmm.
And not all of us are really exposed to this growing up. So
Right.
as soon
Right.
as you're an adult, go figure this out, learn
Yeah.
this skill, practice this skill. Because it's really the thing that makes the difference between feeling like you don't have any control over your emotions or actions to finally feeling like you're in control. Not
Mm-hmm.
necessarily that you're in control of your emotions, but you're in control of your actions, truly,
Yeah.
and that you can really not feel so easily swayed anytime something happens and you're like, oh damn, I don't feel grounded. Now I'm
Mm-hmm.
like wobbling around and every single thing somebody says is making me feel like I'm drifting. But what is that Katy Perry song? Like a plastic bag.
Oh yeah, fireworks.
Yeah,
I'm
fireworks,
drifting through
exactly.
the wind, wanting to start again.
You don't want to feel like that and you want to
I'm
start again.
butchering it.
This, learn this.
Yeah, yeah. No, I agree. I think this is like if somebody wanted to work on some even one thing, this would be something I would recommend. Like
Oh yeah.
it's
This is like
monumental when you learn this.
literally, this is the foundational thing I teach all of my clients. And no
That's
matter where
good.
you are, there's always a little bit more to be learned in this area.
Yeah, I love it. Okay. So, I did a lot of like Google searches for like research and articles. There are a lot of articles and research about emotions in general, like in South Asian communities. But I didn't want to spend a lot of time on that. I really wanted to focus on emotional regulation or dysregulation, right, in South
Mm.
Asian communities. So I feel like I have like one article that I'm going to talk about, but
Okay.
I think a lot of it is probably going to come out in our discussions in our story. I
Yeah.
have some things I'll share in my story too. But just to kind of share things that I did find, I mean, going back to the reasoning behind emotional dysregulation that we discussed earlier, right? Trauma is one. And so, as you know, just being in the South Asian culture, there's a lot of intergenerational trauma, there's a lot of emotional trauma that children experience. And so I found this article, and believe it or not, it's literally called 10 Types of Childhood Emotional Trauma in South Asian Families.
Okay.
And so there was a lot, or there was like, it went into detail of each one, but I will name them for us just to breeze over and kind of understand like these are the types of trauma that children experience, like emotional trauma that can contribute to emotional dysregulation. Silent treatment,
Oof,
passive aggressive behavior.
really started off so strong.
I know. Not allowed to have a different opinion or belief.
Okay. Hmm.
Feeling unheard or unseen.
Yeah.
Unrealistic expectations, emotional and verbal abuse,
Mm.
lack of autonomy, sense of personal control, independence, not being allowed to access external supports and resources. That's a big one. Guilt tripping, and a lack of physical affection. Mm-hmm. And some of these, I was like, oh, this is emotional trauma. Like, I was thinking about it myself. I was like, oh, like that, like not allowed to have a different opinion or belief. Like, you just think, okay, yeah, that was like a thing that parents would do.
We
But it,
normalize it. Yeah.
yes, we know it's normalized, but it is emotional trauma. It
Mm.
is emotional trauma.
Wow.
Um, okay. And then, so those were the 10, like the article goes into detail about it. So like imeaningful.com, that's where this is from. But I didn't want to like read each and different thing. I just wanted to name that just so we're aware. Like these are the types of emotional trauma that many South Asian children might experience or have experienced already. And now they're trying to, what you said, right, to turn that emotional dysregulation into emotional regulation. Okay. So that was my South Asian kind of background.
Mm.
A little short and sweet, I know, but I have a story for you.
Let's get deep into the stories.
Okay. I know. I was like, when I was writing this, I was like, oh, this is like my own personal journal, it feels like, but we're going to blast it.
Well, this is purposeful. This isn't like
Yes,
some accidental
it is
at
purposeful
all.
and personal.
Mm. We're getting vulnerable. Let's do it.
Yes. Are you ready?
I'm ready.
Okay. So I'm going to talk about two aspects of my life, like personal and professional, and we'll start personal. So, personally, growing up, I struggled with emotional regulation a lot. Pre therapy, I'm starting to use that term a lot, like pre and post therapy, right? So,
PT before therapy, AT after therapy.
yeah. Yes, PT, pre therapy. I used to be very reactive. I would jump to conclusions that I'm being attacked and not think of alternative explanations behind what is being said to me. Like I would immediately jump to like, I'm the one who's being targeted, I'm being attacked, and I would get really upset. And I really think that this was modeled for me growing up. Um, my mom and I often would get into heated arguments, especially when I was in middle and high school. She tends to be very reactive. And again, it's not her fault, right? Like emotional dysregulation can stem from trauma, like we talked about. And she has experienced many traumatic experiences in her life. I feel like there's a lot of intergenerational trauma in my family. So, again, not her fault, but that is something that I noticed growing up. And sometimes I still do, where she's very reactive. Um, and tends to jump to conclusions when something is being said to her and she automatically thinks it's attacking her, even though that wasn't the intent. So I would get into heated arguments. I would frustrate, cry a lot. I feel like I used to do that a lot and not as much anymore. Now I feel like crying is more cathartic and like personal for me. But in the past, I guess pre therapy, like because I didn't know emotional regulation, I didn't know how to do it healthily, it was just pent up in me. And then while during heated arguments, I would just frustrate cry. Like I would just start crying
You
frustratingly
had to
because
go
I just didn't know. Right, right. So it came out in the form of tears. Um, so after starting therapy, right, I learned and implemented healthy strategies to help regulate my emotions. So I started journaling, exercising, practicing mindfulness. I was also not being willing, like, this is a little bit jumbled, but like before therapy, I wasn't able to accept and validate the emotions I was feeling because I felt ashamed of them and guilty of them. So when through therapy, I was able to learn to accept them, right? That they're not good. There's no such thing as good or bad. They're just there. And they're there for a reason. And it's important for me to work through each one of them, sift through them, and figure out the reason behind them. And I really like, and I think the last or couple episodes ago, you said a lot of our emotions are there to protect us. It's like a protective factor. And so I think that mindset, my therapist helped me understand too. Like these emotions are still a part of you. Like you need to love all parts of you, right? Including the ones that maybe are inducing some shame and guilt, because there's nothing wrong with those emotions either. And I think like really zoning in, our episode title.
Love when it drops.
I know. Really zoning in on each emotion and not only like naming it, but I think the validation and figuring out the why went hand in hand for me. So, like,
Mhm.
me figuring out why that emotion is there was because what helped me validate the emotion. Like, for example, um, this is like me getting very personal and vulnerable. Like, trust issues is something that's like very common. I grew up seeing in my parents and my family. And so when I first started dating like Aliman, it was really hard for me to like 100% trust. And I started like feeling a lot of those emotions that I wasn't proud of, and instead of working through them in the beginning, I would just kind of bottle them up, kind of dissociate and not really think about them. And then, but it would come up and bubble up in different ways, in unhealthy ways. It would make me react impulsively, say things to Alima that I didn't mean, right? But, through that work, I was able to zone in on each one and figure out, okay, like it's not my fault that I'm feeling this. Like this feeling was modeled for me. Like it's a protective factor for me because as a child, I did experience emotional trauma of like watching the reasons why those trust issues were there in my household. So that was really helpful, right? Like it's almost as if you're zoning in, but also zooming out. Like you're zoning in on the emotion, but you're like figuring out, okay, what part of my life do you think this triggering this emotion? Like it could be in the past, way in the past, that maybe you didn't think about. So zoning in and zooming out. Double Z.
Zoning in on what is the emotion, but then zoning back out to observe the
Yeah.
emotion.
Yeah.
I
There.
love it.
Observe and figure out reasoning, the trigger. There you go.
Yeah. Get curious to it, understand it.
Yeah. So that was
Mm.
like my personal side. And I think, well, before I get into my professional side, I think I have experience. I think I'm a I don't want to say victim because it's not a negative thing, but like I'm just like a person who has firsthand experience
Mm.
from shifting from having emotional dysregulation to emotional regulation. And now with all this work, it's paying off, right? Where after recently getting married, me and Aliman, we've had our, like, as a newly married couple, we've had our like things that we have to figure out.
Mm.
And there's things where in the past, pre-therapy, Michelle would have reacted emotionally, would have reacted impulsively, would have think that he's attacking me. But it was so much easier for me to like stay calm and like
Mm.
just hear him out to figure and don't assume that that's his intent of what I'm thinking, and then speak what I want to say after he's done, and then say my piece and set my boundaries.
Okay, moment of
Yes,
celebration.
it was really cool. I was like, and then when I go back home and visit my mom, like she sometimes will have this similar behavior I used to have because that's how we would get into heated arguments. Like she would react impulsively to what I say, and I didn't mean to say it the way she took it, and then I'll react to what she said to me, even though she didn't. Like it would just be a cycle. And then now I don't do that anymore. Like she'll react, and I'll just like sit with it and be like, why is she acting that way? Like it's not an attack towards me. And so I'm not giving her that back in return. And so I think that's like helping her like simmer down and be like, oh, like help her think about it differently to the situation,
Ooh,
whatever we're
those
talking about.
cycles. Love it.
It's hard work. It's hard
Yeah,
work. But you
it's work
can get there firsthand experience. Still working in progress, but progress over perfection.
over perfection. Totally. There is no
Yes.
perfection.
Yes. Okay. But now I wanted to talk about my professional side because I do this so much. I do this every single day, and I'm really excited to talk about this.
Okay, tell
So,
me.
professionally, as a child life specialist, I
Mhm.
work with a lot of oncology pediatric patients and families
Mhm.
every day who are undergoing some of the most traumatic experiences that they have had, right? And the diagnosis that I work with, which is leukemia, especially, like majority of the patients are diagnosed with leukemia, like that treatment is up to 3 years. Like
Mhm.
it's a long time, right? Being away from school, friends, family members too, if home's far away. It's just it's very traumatic for the patient, for the family. And so a big part of my job is helping these patients and family cope, right?
Mhm.
Promoting positive coping, decreasing stress and anxiety. And so one way I do that is talking about emotions, like almost
Mhm.
every day, right? I talk about these emotions, I normalize emotions. I'm discussing different emotional regulation strategies with my patients and families. And an example I wanted to share today was that there was one time I was working with a school age patient, which is like, about like the age of like 6 or 7 to like 12 or 11 to 12, that range. This patient was about to get a blood draw, a needle procedure. And when I walked into the room, like I noticed that they were crying. So I got down on their level and introduced myself gently. And I then helped them name the emotion, right? They were experiencing. So I said, I noticed you were crying. Are you feeling sad, nervous, angry? And the patient responded and said, nervous. So
Mhm.
I thanked them for letting me know and normalized it by saying, it's okay to be nervous. Then I asked, why are you nervous? Or like, can you tell me why are you feeling nervous? And most of the time, whenever I ask this, patients will say the needle or the poke or the shot. Like, I don't want that. So this patient said the same thing, like the needle. And so I normalized that feeling by saying that there's a lot of other patients that are your age that say the exact same thing. They are nervous about the needle, and that is totally okay.
Mhm.
And so then I provide a brief, developmentally appropriate explanation or reasoning for the importance of a blood draw. So I'll say
Mhm.
something, depending on the age too, like I'll say something like, doctors read our blood like we read books. Our blood helps doctors understand what is going on in our body. So I'll kind of give the reasoning of the importance of that procedure after validating the emotion and naming it with them. Um, and then I go into discussing different strategies to help them regulate that emotion and decrease their stress level. So I'll
Mhm.
say something. So for this patient, um, I said, sorry, I lost my train of thought. Okay. So I'll say something like, a lot of your patients that go through that have to do a blood draw, they tell me different things that help them. So some things they'll say that helps them is taking some slow, deep breaths, playing I Spy or a game on the iPad, keeping their arm relaxed like a noodle or like just relax, and having a comfort item or person next to them. So like in
Mhm.
this case, the patient chose the mother, their mother was present and holding the mother's hand. So during the procedure, like we were able to take slow, deep breaths. And in this specific situation, too, like before I even gave the reasoning, the development of appropriate explanation, because they were crying, we just talked about just taking deep breaths together. Like we just took deep breaths. That was really important because, again, our brains cannot comprehend logic and reasoning until our emotions have regulated, right? So
Oh,
when that patient was crying, I was just focused on like calming them down in that moment, right? After validating and normalizing, like, let's just take those deep breaths. So it was successful. Like, even the nurses thought in the room, like, oh, we're going to need extra people to hold this patient still. But we didn't need any extra people to hold still. It was just me, the nurse, and the mother. And
awesome.
it worked. It was, and this is something that is so exciting. Like every room I go into, it's always different.
Mhm.
Sometimes, like the emotions that we'll talk about are really different. Like my last intern student I had, she made like this badge card that has all the new Inside Out characters. And so I've had patients notice that and be like, and point to what they're feeling. Yeah, I had one like school age patient, very intelligent, very smart, has been going through treatment for a little bit over a year now, almost 2 years. She's so smart and she noticed it. She got excited and I told her, like, you can tell me what you're feeling right now. And she was getting her port access. And she pointed, she was like, can I pick multiple? And I was like, yeah. And so she like touched envy, anger, and fear. So I asked her, like, okay, like, why are you feeling envy? And a lot of kids will pick envy because she's just so cute, right? Like the eyes. But I wanted to see if there was a reason. And she said, because I have cancer. Like, that's why I feel envy. And I was like, that's totally fair. Like, I hear you. And then she said angry because she has cancer as well. And then fear because she doesn't like needle procedures. So
Mhm.
that was really cool. Like even that one thing that I had on my badge she was able to name and regulate her emotions or even talk about them, right?
Amazing.
And then I've talked,
Jump in here. How? I mean, I hear you like have pride, but like you're breezing past it. To me, hearing this, like, oh my god, that's amazing. Like
you're
Mashal,
so sweet.
you're like literally with a population that especially needs it. These young kids who are going through something so freaking scary, who already
Yeah.
probably don't have those emotional regulation skills,
Yeah. Or
and they
still
really,
working
really
on developing them, right? Like they're
yeah.
young.
And
Yeah.
here you are really modeling them, creating safe space for them, and like really giving them opportunities to practice it so early on. Ah, it's
You're
amazing. I'm
so
just gonna take a
sweet.
pause. We're gonna take a pause and we're just gonna celebrate how amazing you are, what you do.
Oh, you're so
Just gonna do some
sweet.
claps.
Oh, thank you. Thank you.
So
I could say the
sweet.
same thing about you. We do the same thing almost but in different ways, even though I'm not licensed, but like
It's
our
amazing.
purpose is similar, right? Like we're trying to support our clients slash patients and families.
I'm really glad you share that though. I don't feel like we talk enough about this side of things or what work looks like, and it's nice to hear, this kind of impact. But this is awesome. I'm so proud of you.
Thank you.
Goodness.
Thank you. Okay, I'm almost done.
Yes.
Last part of my story was also sibling work that I do. I think that's sometimes this part of my job can easily be looked over because out of sight, out of mind, a lot of siblings aren't present, they're at
Sure.
school, but they are also getting affected
Sure.
with these diagnoses and treatment, right? It's symbolic loss that they experience, right? Their parent that's taking care of that patient is not present with them wherever they are, especially if there's long term admission in the hospital. Their sibling that used to be one way is not the same anymore. Maybe they're not as energetic anymore. There might be hair loss. They might look different, right? There's just a lot. Their likes and dislikes might be different too. Like I've had so many patients who we used to have a favorite food before starting chemotherapy, and then afterwards, like they hate that. So like lots of changes. And so I've learned that when doing sibling support and sibling education, every single sibling I've talked to in the past 3 years I've done this work, they have all kind of said they tend to withdraw in some way or another and they don't share their feelings with anyone since they don't want to worry the parents as they are already worried about their sibling who's the patient. So they often will open up to me for the first time and we'll discuss, healthy ways to regulate emotions, maybe talking to a licensed counselor, therapist, right? We talk about the importance of not keeping emotions inside, right? I'll talk about the regulation, like they can bubble up if we do, they'll erupt like a volcano, they'll make us do things that we don't want to. And many siblings will respond well to that, right? They'll choose some ways. I'll provide options. I'll say, like, I'll try to normalize and validate them too. Like, every single brother or sister I've talked to, they feel the same way as you. Like, it's okay to feel what you're feeling. If you feel jealous that your parent is spending more time with your brother or sister who's sick, if you feel angry, if you feel sad or worried, right? All that is normal. But it's important for us to take it out from the inside of us, whether that's putting on paper, like journaling, whether that's telling someone how we feel, like talking to a trusted adult or speaking with the counselor. So my goal is to have them pick a strategy of how to help with emotional regulation. And I even had one sibling who was like, it was a teenager, and he was like, I hate journaling, I hate writing, but he's like in band, he loves like playing instruments and just being expressive. And he was like, I'm going to try doing a voice memo and then just delete it afterwards. And I was like, that's a great idea. It's like voice journaling instead of writing. Yeah. And I remember following up with this sibling the next time I saw him, and he was like, he seemed so much better and better spirits. And he told me that he's been keeping up with it and it's been helping, which is awesome. Um, it's really cool to like work with the same families continuously, like throughout their journey, because I get to see the long-term coping as well, which is really cool. And then this is like the last piece, my favorite part, which is like, I want to hit on how emotional regulation can start at a really young age. Like, I've seen kids as young as 2, like, be able to figure out and learn different types of emotional regulation. Like, we have a medical play resource that's like an animated duck. It's really cute. Like, it connects to like the Bluetooth, like through an app on a phone, and it reacts to like the patient's feeding the duck through the camera and like giving the bath. It's really cute. Like, it's animated. But my favorite part of the duck is that it comes with these emojis, tokens. And when you place each emotion on the chest of the duck, the duck reenacts the emotion.
It's cute.
So it's really cool. Like, and so like it helps kids as young as 2 like see the emotion play out outside of their body, right? On the duck. And they can pick that emotion and like put it on the chest. And so I remember like playing with one of my patients who was like 2 years old, and like she put the calm emoji on the chest of the duck, and the duck started like taking deep breaths. It was so cute. And then the patient like copied it. And like me and the parent was like, that's calm. Like, we're teaching her emotions. So it was really cool. And I like encourage the parents to do this at home too with them.
That's amazing. What a fun little way. Like, again, right? Like, there's so much incorporated here of not just, healing the clients, but also helping them through that process emotionally.
Right.
Amazing.
Right.
Even as young as 2.
Thanks.
Like, wow.
Yeah. It's really important too. And I like always tell parents, like, kids as young as 2 still don't have the language development yet to name their emotions. They can use emojis, tokens by themselves too. Like, when they're having like a hard time expressing their needs or what they're feeling, like, you can put 2 out and tell them to point what they're feeling.
Yeah, whatever is like developmentally appropriate for them, but they certainly can model this kind of skill set really young. Maybe just looks a little bit differently, sounds a little different. Makes sense.
Right.
That's
So
awesome.
I know that was a little longer than usual, but that's my story. I just got really excited about this topic.
I love that. I'm so glad I got to hear, we always talk about more on the personal side, but I'm really glad I got to hear a little bit of your professional side of this. I really genuinely didn't realize like how much of this that you do. And it just always blows me away anytime we talk about this, because it's so cool that, you get to see this play out and model this and like create this space for these kids that are going through so much and like help them learn how to do this so early on. That's amazing.
Thank you.
It's fascinating. I'm so proud of you.
You're so sweet. Thank you. I appreciate your support and love and support always. So sweet. Heart.
Well, are you ready for my story, darling?
Yes, I'm ready.
It's going to be kind of the same as yours, at least on the, personal side. Very similar. As usual, what's new, right?
It's like almost as if like, are we all, does anybody have an original experience, right? Like,
We're
Like
all like
it's
mini clones of one another.
right.
Yeah, I mean, I really think that speaks so much to like the way that we all kind of grow up in such similar
Mhm.
household experiences. Oh my God, this reminds me of like, that blue tin, the Danish cookies, I think it,
Yes. Oh my
that
gosh.
every single
Sewing
brown
kit.
household uses a sewing kit whenever you're
Yeah.
done.
Yeah.
Totally. Like,
Yeah.
how? Is there a secret meeting of like brown
Yeah. Isn't
moms
that
who are like,
crazy?
hey, look at this. This is what I'm doing. And you're like, oh, yeah, me too. I'm going to do that. Like, how?
So weird. But it's
It's,
almost as if like it helps you not feel isolated in your experiences, right?
it's
Like when you
fascinating.
talk about it. Yeah.
Yeah, it's fascinating because it's like in a way we're all kind of connected like that.
We
I
are.
love that.
We are. We are.
So similarly to your story, I have a before therapy and after therapy story.
Okay. I'm ready.
Before therapy, I mean, I've said this so many times on this podcast, right? Before therapy, I just did not have the kind of emotional regulation skills because it just wasn't something that I saw modeled to me.
Mm-hmm.
My mom was, as I talked about in the past, right, a little bit like calm, and then she would blow up because she would hold something in, or she would be passive aggressive. My dad, on the other hand, was kind of like that, except a weirder, further scale of like
Hello.
long, 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 long periods of calm and like kind of goofy, silly, like, no, whatever, no big deal, but very like calm, mute, not a lot of words. And then when he really got mad, he would raise his voice. That's when everyone would have to listen,
Oh,
right? And
yeah.
that happened very rarely. But when it did, you were like, oh, okay, what's happening now? Right.
Yeah.
So I didn't really have many examples exactly of like, okay, what the heck is regulating? What does that even mean? Like, what does that even look
Mm-hmm.
like?
Mm-hmm.
And obviously, me talking a lot about like the people pleasing side of my childhood and continuing on this kind of expectation of being quote unquote the good girl, right? So
Yeah.
similarly to you, when I was reflecting about that time, I was thinking about how did I emote though? I never shared how I was really feeling. Well, maybe never is too dramatic. I very, very rarely ever shared how I was really feeling. Most of
Mm-hmm.
the time, I just be like, it's fine. It's okay. It's fine. It's okay. Just like
Yeah.
bottling it all up. And so obviously it has to go somewhere, right? So for
Yeah.
me, that would look like me saying it's nothing, then running up to my room, closing the door, and eventually when nobody could hear
Mm.
me, silently crying and like bawling and being
Mm.
angry and like sad tears, angry tears, whatever kind of tears.
Yeah.
But on the outside, all anybody really saw was more so like, there goes Anu being all moody as in like I was just kind of shutting down because I didn't feel like could share outward what was happening internally. I mean like let alone I just didn't understand to do that,
Mm-hmm.
right?
Mm-hmm.
But then at a certain point, I also kind of didn't feel like I could do that, not only because it was a model, but I also felt like guilty. I also felt
Mm-hmm.
like it was really ungrateful to be feeling angry at somebody or to be feeling disappointed in something or upset because
Mm-hmm.
like what's the big deal, there's people out there who have it worse than you.
Mm-hmm.
So I feel like even if I was even remotely able to identify what I was feeling here and there, I shut it down because I saw it as quote unquote bad emotion. You shouldn't feel
Mm-hmm.
that way, right?
Yeah.
Obviously after therapy, for therapy, after therapy, I
Mm-hmm.
really learned a lot more about like how this behavior, this pattern of me bottling things up, how it just really wasn't serving me. It really just wasn't doing what I even wanted it to do, keep the peace or like whatever it was. It wasn't even doing that, right? Because then I would
Mm-hmm.
eventually blow up in some way, right?
Mm-hmm.
Um, and like I remember even this was during college and I was going through all those medical, things, right? So I, for the first time, yelled, right? Like I mean, I bottled it up and that's when it blew up. But instead of
Mm-hmm.
blowing up and like just tears, it was tears and verbally like yelling. And like that
Oh.
was the first time I'd ever done it. I was shocked by myself and I was very like, I felt a lot of shame around it. But I
Mm-hmm.
also realized that is when people like started listening, like really hearing what I was saying.
Mm-hmm.
So in a
It
sense,
was
I was learning not to
reinforced.
bottle it. Yeah,
Yeah.
exactly. When you're forced to hear like the volume of what I'm saying. Kind of like I
Mm.
said earlier, right? Like that's how my dad is. Like usually he's just very
Yeah.
happy go lucky until he's like yelling and then it's like, oh wait, everybody listen up.
Mm.
And so I kind of it reinforced that within me too. Like I learned that if I yell, people will listen. And I still don't try to yell, but that's what ended up happening. Like if I got pushed too far, I no longer had the ability to bottle it in. Like I would just say what I need to say, say what I need to say, say what I need to say, as I learned in therapy,
Mm-hmm.
but it wouldn't be received. Because what I
Mm-hmm.
didn't learn is how to set a boundary and enforce it. What I learned was not to bottle it up. Right. So
Right.
part one therapy, I should say. um, so basically, yeah, I kind of this was like a new phase of all of this patterns going interestingly.
That is
Um,
interesting. Yeah.
but you know, I see like that as like part one. The part two piece of my post therapy is my training as a therapist. Because as I was learning and being trained as a therapist, whether in school, whether outside of school,
Mm-hmm.
I learned so much by working with my clients that even now, like I'm constantly still learning. And so once I realized a couple of years ago, even not even that long ago, just a couple of years ago, I realized that even though I feel like I yell because I get to that point where I'm just like, nobody's listening to me, I have to yell, it doesn't have to be that way. And it's still not effective. It's still not helpful. Yes,
Mm-hmm.
they might like shut up and listen all of a sudden, but what am I really teaching there? That I'm enabling that this is the behavior, this is the pattern, this is the cycle, because you can get me to this place.
Right.
Right. And that's not a helpful thing to learn either.
Mm-mm.
And
Yeah.
that's not very regulated either, right? Because
Mm-hmm.
that's what I was doing. I was speaking from my anger rather than for it, because I still didn't know how
Right.
to do it. I knew now that I needed to speak my emotions, but I didn't
Yeah.
know how to speak for them, how to
It
advocate
was,
for them
you
yet.
made some progress, but not fully.
Exactly. I made a little bit of progress, but it kind of felt like a couple step backward there in a different
Yeah.
way. um, but eventually, especially through my training, particularly with like parts work, the emotional side of things that we're talking
Mm-hmm.
about, inside out stuff, that's when I really understood the difference between like, okay, yes, I need to speak what I'm feeling, but there's a way to do it that's effective, and there's a way to do it that just isn't really effective and just feels really gross and icky to me. So it's like we were talking about earlier, lean into the emotion, understand it, be curious to it, don't judge it, but then lean away so that you can observe it without being consumed by it. Because it's
Right.
like, when people say like, oh, I saw red, that means like you're so angry, your vision is totally blurred, all you can see is within that part of
Yeah.
yourself, which is anger, and all that anger sees is red. But if you lean away, you can say, ugh, like I'm so angry right now, but I'm not gonna yell. You get really quiet. That's a new thing that I've been doing. I get really quiet when I get angry. I get really quiet and I go, I almost like whisper. So it almost like breaks the tension. It's funny, it's weird. It's also a little bit deadly-ish. Or no. So instead of yelling, I get really quiet. I really get really dramatic, and then I
Mm-hmm.
kind of communicate. I'm trying not to, but this is really upsetting. I'm gonna go take 5 minutes, and then we're gonna come back to this. And here's what I need. Right. So like really speaking for that anger, because that anger is there for a reason. The anger is
Right.
saying, "Hey, you deserve better. You're not being treated fairly."
Yeah.
That's a good thing. Your anger is looking out for you.
Yeah.
But if you let it speak, it's going to be yelling, and then that person's going to yell because now they're defensive, and then you're going to yell, and they're going to yell, and you're going
Yeah.
to yell. It's
Yeah.
just not helpful, right?
Right.
Um, but the latest thing I want to talk about, just I think 2 weekends ago, maybe
Okay.
2 or 3 weekends ago, literally this month itself, or well, we're on October 8th, so in September,
Mm-hmm.
me and Adi, my husband, were out for date night, and we're just chatting about like kind of past how far we've come in our relationship, and like just kind of reminiscing basically.
Mm-hmm.
And he said something that I was just like, what? He basically called me out and said, you're very defensive. And I was like, me?
Oh.
Defensive? I'm not defensive. I'm way too emotionally regulated to be defensive. I'm a therapist,
Oh.
Aditya. I'm not defensive. I was like, what do you mean defensive? But then we were talking about it. And over the last couple of weekends too, like I've been noticing, I'm like, yeah, I am defensive. It was a
Mhm.
total shock to me. So it's like I'm peeling back layers. Part one therapy taught me one thing, my training taught me one thing, and now being just open and continuing this process, I'm peeling back all these like new layers of things that I can keep
Oh.
growing on. But it was crazy to me because when he pointed it out, I got defensive. I was like, I'm defensive. That's not me. What? I can't possibly get defensive. What do you mean?
Mhm.
Right. But then I kind of slowed down and I took a deep breath and I was like, okay, yeah, that was kind of defensive answer, wasn't it?
Mhm.
And then I kind of took a step back and I said, like we had a really great conversation about like, okay, well, when else have I been defensive? When else have you felt like you couldn't share something because I got defensive
Mm-hmm.
or I wasn't hearing you? And like, it was just such an astounding and amazing, a very reflective experience. But what that's kind of taught me as I was reflecting about all of this lately is that there are so many layers to this.
Yeah. There
Just
are a
like I
lot
was
of
saying earlier,
layers.
right? Like, no matter where you are in terms of your emotional intelligence, in terms of your building the skill emotional regulation, I bet you
Mm-hmm.
there's probably more. After
Yeah.
I'm done dealing
There's
with
so
this
much.
layer, I bet there's going to be another layer for me. I'm sure.
And there's just like, it's years and years of unlearning and undoing too.
Yeah.
Like it doesn't
Decades, not just
happen. Yeah.
years. Literally decades of
And if
unlearning.
you count intergenerational trauma, like so much has been passed down and learned, and these layers are thick,
They are.
right?
Yeah. But the difference is in the past, I will say in the past I was very like I felt a lot of guilt and I felt a lot of shame and I judged myself a lot for it. And I kind of told myself like you should have done better, you should have known better, like how could you do this? Whereas now I was regulated enough and aware enough to actually
Mm-hmm.
say to him like, listen, I'm hearing what you're saying and I'm going to really think about it and I'm gonna make some changes and let's keep talking about this conversation. But I also want you to know, like, usually when one takes responsibility, you might see like this frantic, like, oh my God, I'm so sorry. I didn't even, you might see that kind of language. And like, I'm
Mm-hmm.
not doing that right now because I don't feel guilt and shame for having done it
Yeah.
because I know that I just didn't know better. I didn't realize what I was doing, but I am very, very like sorry that I did that. And so I feel like that's like one good thing in this growth process, even though we're
Mm-hmm.
uncovering new layers, possibly, we can still grow without it kind of needing to like shake our core and be like, ah, you're such a terrible
Yeah.
person.
Mm.
You're not a terrible person. You just don't know what you
Yeah.
don't know.
Yeah.
Yeah. Growth
And what
mindset.
you're feeling
Boom.
and thinking is not your fault. Like it comes from something. There's triggers involved.
Yeah. You're responsible for your behaviors, but you don't like take responsibility for what you've done, but don't take over responsibility and then be
For your
like, okay, now I owe my
emotions.
life to you. Like, okay, well, back
Yeah.
up. You didn't know what you didn't know. You're learning. It's okay. Take responsibility and do differently now.
Right.
Yeah. Yeah. So that was my story.
I just I'm just so proud of you.
Mhm.
Like I didn't realize that. Well, obviously we haven't caught up in a while, so I didn't know what
It's been a
happened
minute.
the last month, right? Their reaction to it was very inspiring. Like I feel like I'm still working on my next layer of emotional regulation. I feel like, what do you mean? What do you mean I'm so self-defense or I'm defensive? Like I would get defensive more.
Totally. Yeah.
Yeah.
That was me
So
3 months ago. Not ready to
yeah,
hear
but
it.
like props to you for, just listening and being open to his perspective and then leaning in and being like, okay, like maybe there is some truth to what he says and his perspective. He's my husband, he's with me a lot.
Mm.
Like let's look in, let's reflect. And then,
Yeah.
that's amazing, right? Like that
Mm.
takes a lot of work and strength,
Totally.
Yeah.
Yeah.
So
It's
proud
just,
of you.
thank you. Yeah, good job, Anusha.
Yay. Go
I think
Anisha.
it's a great thing too to be able to be that open, but I will say like no sugarcoating it. Like it took me a while to get there.
And that's okay.
It took me a while to get there. It did, and I had to
That's
own that
okay.
too. I had to own like
Yeah.
because this isn't the first time we've had this conversation, but there was just like other things I'd be like, oh, and now I'm
Yeah.
realizing okay, that was also like partly the defensiveness showing up,
Yeah.
but it took a while,
Yeah.
a year or two, not
And
great, but we
sometimes it
got
takes
here.
longer for people, right?
Yeah,
Like you're setting a great example.
we get there eventually.
Yes, our work never stops. And that's
Mm-hmm.
because we're always evolving, we're changing, our
Yeah,
life events are keep happening, you
yeah,
know.
yeah. Everything plays on everything.
Right. I'm so
Your
proud
life
of you.
events, your
Mm-hmm.
own wounds and dramas, your
Mm-hmm.
complications of all your hormones and blah blah blah. That's definitely
Mm-hmm.
a
That's
big thing for
why
me.
skills like adaptive emotional regulation will come in handy.
Oh yeah, definitely. This was a good
Thank you.
topic. I
Yeah,
really
it
enjoyed
was.
it.
Me too. Thank you for sharing and being vulnerable, even though, and it was a very recent vulnerability to share. So thank you for doing that.
Hasn't scabbed yet. I'm
Props
just
to
kidding.
you. Yeah, really. I'm sure but like it's still open and healing now.
I'm still bleeding. It
I
was a
can,
really good conversation though. I really liked like our stories around this, our reflections around this, and
mm,
I think there's so much more to go here. I honestly feel like we could do a part 2, a part 3 with this too,
yeah,
eventually.
for sure. Yeah. I think there's like so much that we can go into that we didn't even scratch. We only like scratched the surface, like, like the broader South Asian community, or
Yeah.
just like how this dysregulation can be kind of taught and transferred in like the bigger family units, right? Like not just like in your
Mm,
immediate households, but this is something that's modeled with siblings and siblings, aunts and uncles,
yeah,
grandparents, right? Like
totally.
there's just so much more that we can talk about.
Maybe next time we'll pull in some family, get their
Yeah,
take on it.
there you go. Maybe we can have them as guests. Can you imagine?
Yeah. Abby's been telling me like, oh, you should have your family on as guests. That'd be so funny. That'd be awesome. And they're all like, no, pass.
I haven't even asked yet.
You're not
I don't
gonna.
even know how that will work out.
Oh, it would be funny though. I think it would be
It'd be
really funny.
interesting. Yeah. If we did like interview style,
Yeah.
it'd be funny.
It'd be
It would
funny
be
if they're
interesting
just
to hear their
roasting us
perspective.
though.
Yeah,
Here we are bringing them onto the podcast and they're just out here like roasting us,
I
being
know.
awesome personalities.
Exactly. We'll do a
Apart.
part 2 debrief episode after that then.
Oh yeah. We have to break down the reactions of what's happening and be
Yes.
like, whoa, can you
Yes.
believe?
Right. Right.
Okay, let's wrap up today, shall we?
Okay. Yes.
Let's do it. So, a reminder, if our podcast has resonated with you, if our topic today has resonated with you, as I imagine it will for a lot of people, and you'd like to share your own story, maybe ask us questions, you can reach out to us at talksouthasiantome@gmail.com. And you can find us on all the socials at the handle at talksouthasiantome. And if you just want to gab about this, reach out to me. I will keep talking your ear off about this. If you want to learn about it, reach out to me.
Yes.
All right. Catch you guys in season 3. We're going to be taking a
Yeah,
little
this is why.
hiatus, little
Yes,
break.
we'll take a little break. I forgot
Yeah.
about. I'm glad you mentioned that. We're
But
going
we'll
to
be
be
back
back in
with
a little
lots of
bit.
fun content.
Yes, season 3 coming soon. But for now, a little bit of break.
Yeah. So stay tuned and have a fun vacation. Go listen to some of our old ones.
Yeah, season 1, season 2 now. We got 2 full seasons in the
Yeah.
books. All
Alrighty.
right.
Toodles.
Bye.